This is Dr. Ron Valdesari, Deputy Assistant Secretary for Health in the Department of Health and Human Services. I'm here at the International AIDS meeting in Vienna with my friend and colleague, Dr. Kevin Fenton, who is the Director of the National Center for HIV, Viral Hepatitis, STD, and Tuberculosis at the Centers for Disease Control and Prevention. Kevin, I wonder if you could share with our audience what some of the important CDC prevention research has been at this meeting.
Absolutely, Ron, and thank you. It's great to be here. As you know, CDC has a number of presentations and posters at this meeting. I think two of the more important studies that I wanted to highlight are studies related to the relationship between poverty and race and HIV in the United States. And of course, the second study is on the safety and the safety profile of PrEP among men who have sex with men. So I'd love to speak about those two studies because I think they're two of the more exciting pieces of research that we're presenting at this meeting. Our first study on poverty in the United States is one of the largest studies done to examine the relationship between low socioeconomic status, race, and HIV in the United States. We looked at 23 cities across the country, and we combined HIV reporting data with US Census Tract data on socioeconomic status. And we were able to show that low socioeconomic status, household income, level of education, being homelessness or not, many of these social factors were some of the main determinants of high HIV prevalence in the United States. So very, very interesting and very important study. The other study that you had asked, I'd like to speak about is our study on the safety of pre-exposure prophylaxis among men who have sex with men.
And that's what you meant by PrEP.
That's right. And as you know, Ron, we have been very committed at CDC to be advancing new prevention technologies, especially on the biomedical approaches to preventing HIV. Now, in this study, we looked at the safety of pre-exposure prophylaxis, that is, having men take oral antiretroviral treatments on a regular basis to see whether or not that would prevent them from acquiring HIV. Now, this study was not done to show the efficacy of PrEP, but simply the safety, and we were able to show that it is safe. There were very few adverse events from taking the pre-exposure prophylaxis. Right. So very, very exciting study.
So I guess next comes the look at whether or not PrEP can actually reduce new infections.
Absolutely. And there are a number of studies being done by CDC and by the NIH, as well as other partners, who are looking at the effectiveness and efficacy of PrEP. And we expect some of these results to be available in the first and second quarters of 2011, so in a year's time. And then subsequent studies will be available after that.
Great.
So very exciting time for the field.
Great. Let's switch topics now, and I know you're very well aware of the fact that this past week President Obama and Secretary Sebelius released the National HIV/AIDS Strategy, and certainly CDC had many different important responsibilities in that particular strategy. I wonder if you can briefly just share with the audience why you think the national strategy is important for prevention activities in America.
Sure, I'd be very happy to. You know, national strategies are critically important to really galvanize the hearts and minds of leaders, of communities, of federal agencies, of people living with and affected by HIV, to galvanize us all into a shared vision for bringing an end to AIDS in our time. And I think this is the promise of the National AIDS Strategy. It outlines very clear goals for us to achieve as a nation. It has a very clear vision for where we should be going with HIV, as well as very clear steps for implementation. And we haven't had this before in the United States. So I think this is a new dawn for us when it comes to strengthening prevention, treatment, and care for HIV in the US.
Excellent. Kevin, where can people who see this, where can they find more information about these very important studies that you've described for us?
Well, we are releasing information on many of these studies that are presented at the conference, and they'll be available on our website at www.cdc.gov. Search for HIV and visit our HIV site on the CDC website. And of course, on the IAS, International AIDS Conference website, many of the presentations which are done orally will also be available as well.
Great.
The abstracts are also available online.
Excellent. And for those of you who want to learn more about the National HIV/AIDS Strategy, please visit AIDS.gov, where you can read the strategy and all the specific steps that CDC and other partners will be involved in to improve HIV prevention, care, and treatment for all Americans. Thank you.